Good afternoon. We're here to provide an update on phase 2 of our reopening plan and discuss some updates from the command center. But first, I want to give our usual update on hospitalizations and testing. On Thursday, the state reported over 9,000 additional individuals were tested for COVID-19 and 271 positive cases were reported. To date, around 737,000 people have been tested and almost 930,000 tests have been conducted across the Commonwealth. The average positive test rate in Massachusetts is now about 2.3%. Since mid-April, the average positive test rate has fallen by 92%. Right now, fewer than 1,000 people in the Commonwealth are hospitalized. I went back to the middle of April and couldn't find a number that was that low on the hospitalization side. This includes 227 people that are currently in the ICU for COVID-19. Hospitalizations are down by about 72% since the middle of April. The Commonwealth's made significant progress to reduce the spread of COVID-19 and to reduce the number of residents needing hospital-level care. Almost all Massachusetts hospitals are no longer using surge capacity, which represents about an 81% reduction, meaning the healthcare system is open and ready to serve everyone out there safely. This progress is encouraging and proves that we're moving in the right direction as we continue our gradual reopening. We are making the progress we're making because of the actions that people here in Massachusetts are taking every day. Face coverings when you can't be distant, washing your hands, staying 6 feet away from people when possible, and monitoring for symptoms and getting tested if you have any. COVID will continue to be with us until there's a medical breakthrough, but the tremendous progress that we've made proves that these things do work and we can contain the virus. And this is how, over time, we contain the virus and continue to reopen at the same time. On Wednesday and Thursday, as many people know, our administration offered free COVID-19 testing for individuals who participated in recently in large gatherings, particularly the protests to honor George Floyd. Preliminary information we've received indicates that almost 16,000 people have been tested across the Commonwealth during those 2 days, and I think there's testing going on today as well. Yeah, 3 sites that were oversubscribed. We're pleased that so many people went out to get tested, and we should have the test results in the next couple of days. We should keep in mind that COVID doesn't take the summer off. We cannot, nor should we, become complacent. Recently, other states have seen increases in cases and in hospitalizations. The progress we're making here in Massachusetts demonstrates that if we're vigilant and disciplined, we can do both. We're reopening and containing COVID, but it only works when everybody does their job to slow the spread. So we're asking everybody to keep up the fight, and it's up to each of us to continue to do the work that limits the spread and keeps us moving forward. With respect to the reopening, this will be the beginning. Phase 2 began on June 8th. In order to monitor the impact of reopening more businesses, our administration divided this phase into 2 steps. Today, thanks to the progress that we're making in fighting the virus, step 2 will begin on Monday, June 22nd. That means that a number of additional businesses may resume operations. This includes indoor dining at restaurants, and offices are permitted to go from 25% occupancy to 50% of their capacity. The Lieutenant Governor will have more details on that in a moment. While we're lifting the office space capacity limit, employers should continue whenever possible to encourage their employees to work remotely from home whenever they can. And for densely populated areas, specifically Greater Boston, if people can keep teleworking, we can obviously keep crowds off the MBTA for a little longer. The T's worked hard to adjust schedules and practice heightened cleaning protocols for high-touch surfaces. But the best way to prevent the spread is to minimize the number of people being in close quarters, especially in indoor close quarters. There are many people who must commute to do their jobs, and we all have an obligation to do our part to avoid crowding on public transportation and in common spaces. To the extent that companies can continue to support their workers as they work remotely, we highly encourage them to do so. It's not easy for many to work from home, especially with kids and other distractions, but it's incredibly helpful in reducing the spread of COVID, and it also leaves transportation venues open and available to those who have to go to a physical place of employment. All executive branch employees who are currently working from home will continue to do so. The administration is keeping in place our current workplace policies at this time for just that reason. Reopening Massachusetts is working. Businesses are coming back. People are regaining that sense of purpose that was lost. I know it can't happen fast enough, but people in Massachusetts are proving that we can reopen and continue to bring the fight to the virus when we all do our part. I want to thank you once again, and I can't believe I'm saying this again, for washing your hands, for socially distancing, and for wearing face coverings. That is how we contain and beat COVID and continue to reopen the Commonwealth. I do want to close by noting that this morning we issued a proclamation recognizing today, June 19th, as Juneteenth here in the Commonwealth. Juneteenth marks an important moment in our country's history. 155 years ago today, Major General Gordon Granger and his Union troops landed in Galveston, Texas. Major General Granger brought with him news that the Civil War was over. He also read a proclamation that in part said the following: "The people of Texas are informed that in accordance with a proclamation from the Executive of the United States, all slaves are free. This involves an absolute equality of personal rights and rights of property between former masters and slaves." Juneteenth celebrates that moment when some of the last enslaved people in the country were informed of the end of the war and of slavery. This holiday is also a chance for us to recognize the painful history of slavery and racial injustice in this country, and to acknowledge the lasting, systemic impact that continues to this day. It's a chance for us to recommit ourselves to building a more equal and just society. This year, as we engage in a national conversation around racial injustice, recognizing this holiday is more important than ever. And we look forward to working with our colleagues in the legislature on ways we may further recognize this important day in the future. Thank you. And with that, I want to turn it over to the Lieutenant Governor.
Thank you, Governor, and thank you for acknowledging Juneteenth and its importance here in our Commonwealth and across our country, as it marks an important moment in our history and affords us a chance to reflect on the need to make progress toward racial equality. That reflection is more important now than ever, and we are glad to mark Juneteenth with our proclamation today. In May, we presented our administration's four-phased approach to a responsible reopening of our Commonwealth's economy and to also fight COVID-19. We are all incredibly grateful to our communities, our business owners, our families, and our residents throughout the state for their patience and cooperation as we implement Reopening Massachusetts. Businesses and restaurants and communities across our Commonwealth have been flexible, adapting their operations to accommodate to the necessary COVID-19 mandatory safety measures. And we appreciate your efforts, and we thank you. Last week, we announced an important grant to assist our municipalities, and it was sponsored through the Department of Transportation, and it's called the Shared Streets and Spaces Program. This grant is made available directly to municipalities to quickly launch or expand improvement projects like sidewalks, parking lots, and spaces to accommodate outdoor dining and assist with accessibility and access to places like retail shops and services in downtowns and main streets. To complement this effort, today we are pleased to provide details on another funding source totaling $225,000 being made available to nonprofits and community groups to assist local economic recovery efforts. This special Resurgent Places program will allow groups to apply for grants up to $25,000 for projects like outdoor seating spaces and sidewalk retail. So these two programs together offer a lot of assistance, working in partnership with our communities, our municipal leaders, and our nonprofit area as well. Both applications will open this coming Monday, June 22nd. For shared streets and spaces, visit mass.gov, and for Resurgent Places, visit massdevelopment.com/Commonwealth Places. As the Governor has stated, Step 2 of Phase 2 begins on Monday, June 22nd. This step will include the reopening of indoor dining and close contact personal services such as nail salons, and retailers may open fitting rooms by appointment only. As the Governor mentioned, offices may increase capacity to 50%. However, we urge employers to continue to allow their employees to work from home whenever possible. These build upon the previously announced guidances, our mandatory safety standards, and our recommended best practices using templates and checklists to become compliant. These are available on the mass.gov reopening website. All of these guidances, a lot of good information there. And while we are making progress toward reopening our state's economy, it's imperative that our communities, our businesses, our families, our residents, all of you, continue to adhere to our public health guidance and protocols as we transition to a new normal. As the Governor said, it really is in your hands, and you've done a tremendous job working through these challenging times, but doing your part. And as we continue to move forward, we continue to reopen, we need to be cautious and vigilant and continue to do our parts. I'd now like to turn it over to Secretary Keneally, who will expand on what is part of our Step 2 beginning on Monday. Thank you.
Great. Thank you, Lieutenant Governor. As noted, today marks a critical step in the process, both to continue combating the spread of COVID-19 and to reopen the economy according to a methodical four-phase approach. As the Lieutenant Governor said, we got here thanks to the sacrifices made by the business community and their willingness to comply with the safety standards and guidance for each phase. We're also here thanks to the residents of the Commonwealth and their commitment to social distancing, wearing face coverings, and frequent hand washing. Combined, the metrics we're using to decide whether to advance to future phases continue to trend positively. And I can't overstate the importance of this partnership between our administration, the business community, cities and towns, and members of the public. A lot has been asked of everyone in these difficult times, and if everyone continues to do their part, we will continue to make progress together. Recognizing the results of that shared commitment to combating COVID-19, we've made it clear which industries can open in each phase, and we've published safety standards and protocols ahead of the start of each phase and step, so those sectors have an opportunity to plan and to prepare. This was the case for close contact personal services. The standards around social distancing, hygiene, staffing and operations, and cleaning and disinfecting were posted before Phase 2 began. And as we progress through the reopening plan, I want to remind everyone that we will continue to update our website and include the latest standards and protocols at mass.gov reopening. There you will find a number of useful resources, including guidance for industries and activities. And as we've noted previously, during the development of the reopening plan, we received invaluable input from many business, labor, and community groups. And as we now execute the plan, those same groups have fully embraced the responsibility of adopting standards to protect workers and customers alike. So far, there's a lot of reason for optimism. It's very encouraging to see the increase in interactions among family and friends, as well as a burst of activity in local downtowns, with, of course, the vast majority of people following the rules. But the fact is the virus is still here. And as we previously said, the data and not dates will determine next steps. To maintain the momentum we generated, all of us working together toward the same goal. We need to remember not to let up. The trends remain positive and will only stay that way through continued commitment on the part of everybody. Let's build on that progress by sticking with the plan and remaining cautious in the days and weeks ahead. And with that, we'll turn it over to Secretary Sutters.
Thank you, Secretary Keneally, Governor, Lieutenant Governor, Commissioner. Good afternoon. Updates around testing. As you know, we continue to ramp up our testing capacity in the Commonwealth and access to testing. At this point, testing for COVID-19 is widely available. Today, we have launched a revamped testing website called Get Tested MA as a more convenient resource for the public. The website has details on who should get a test and connects with our COVID-19 test site locator. Please check the details and call ahead to the site to determine if an appointment is necessary. If you have questions about if you should get tested, please check it out at mass.gov/gettested. In addition, we're rolling out a new public awareness campaign, including using electronic billboards and social media. While we're expanding options for testing, we're also looking to expand the numbers of providers that conduct testing. The first round deadline to apply is June 22nd, with further rounds to follow. We are particularly interested in applications from providers who are able to stand up new testing sites and/or provide mobile testing options. New sites will focus on vulnerable communities and areas with limited access to testing. As we know, the COVID-19 pandemic is an unprecedented crisis and one that has had significant and disproportionate impacts on communities of color and vulnerable populations, especially for those with pre-existing conditions. When the crisis standards of care were first proposed, these inequities were further exposed and heightened. The standards were revised based upon additional input, and from that experience, the Department of Public Health convened a group of advisors to inform our actions and health initiatives as a Commonwealth to reduce the disproportionate impact on communities of color and vulnerable populations. This group, the COVID Health Equity Advisory Group, just chaired by our Commissioner, Commissioner Brow, began meeting regularly in May and includes members of communities disproportionately impacted who are deeply committed to health and racial equity. Later today, the advisory group and the department will be releasing new data and recommendations to address the disproportionate impact of COVID-19 on these communities. The group made a number of key recommendations, including continuing to focus on data and to disaggregate data across populations and sectors, including usage of mass transit, advocating for the equitable distribution of personal protective equipment for essential workers and residents and professions most at risk, implementing policies that increase housing stability for populations disproportionately impacted by COVID-19. Today's information that will be released in a little while will include new data on COVID-19 cases, hospitalizations, and death by race and ethnic status, and it will be age adjusted. These recommendations are starting points and build upon the long history of the Department of Public Health for actionable next steps, and the department will report on its progress as we move ahead. The first such action is that the public health order authorizing the crisis standards of care is rescinded as of today. With that, Governor?
Questions?
Governor, could I ask you about the interior of restaurants? Is there a capacity limit, or are we just basically doing the 6 feet distance between tables that you're doing outside?
We went with the 6 feet piece as opposed to a capacity limit because we felt first of all, configuration varies a lot from one building to the next. And secondly, I think the guidance that you guys got from most of the restaurant folks was that it would be easier for them to comply with a table requirement than it would be with a capacity limit, because in many cases, the way the capacity limit varies a lot from community to community, and even in some cases, some are fire-based capacities, some are occupancy-driven, some are driven by different standards from one community to the next. It just seemed like the easiest thing to do would be to pick a distancing standard that we were comfortable with and go with it.
And still a max party size of 6 and no seating at the bar, is that the same?
Yeah.
Governor, we know that you're saying to people who work in Boston to try to work from home if they can, but obviously with the restaurants here, indoor seating, one of the complaints we've heard is that they're concerned that people won't even come into the city. Are you encouraging, or just how would you phrase how people should they be coming into our restaurants in Boston?
Well, I certainly think one of the things we learned from the outdoor dining experience, and I should probably let the Lieutenant Governor speak to this, is people liked it and they used it. I mean, we were curious about whether or not that would be something that would bring people back, and I think we were all pleasantly surprised. And I think this one is going to be the same thing, which is we don't know exactly what people are going to do, but obviously for those who enjoy going out to eat, whether it's in Boston or in your local community or in some community nearby, you should know that the standards that are going to be in place that have been generally developed by the Reopening Advisory Board and the industry-specific protocols are designed to make sure that that's a safe experience.
There are some restaurant owners who couldn't survive this long. Do you have any words for that?
I think there's cruelty and disruption all over the world associated with the pandemic, associated with COVID, and in some ways, almost none of it was anybody's fault per se. A lot of it was a function of a change in the way so many of us had to go about thinking about preserving and protecting public health. And the Lieutenant Governor and I and the Commissioner and the Secretary have all stood here at one point or another over the past 150 days or so and expressed our disappointment and our dismay about the impact that both the virus and many of the decisions that we've made have had on people and institutions here in Massachusetts. But if there's one lesson we learned from all of this, it's to respect the virus, take it seriously, don't let your guard down, and do the things that need to be done to make it possible for people to be able to rebuild and reopen. And, you know, we're one of the first states in the country to talk about a contact tracing program. And there were people, when we talked about that at the time, who said it's too late. That program is working. And in my opinion, part of the reason why we have one of the lowest reproduction rates in the country, if you look at the state-by-state reproduction rates, and one of the reasons why our COVID rates continue to decline, and so much of our other information has been pretty positive, is because we've done a lot of the things that were recommended to be done as the information has evolved to get our arms around this thing so that we could find a way back. But this thing has been, here in Massachusetts, this thing has been, and in many other places, this thing has been devastating in so many ways. And part of the reason we have been so careful and cautious about the way we move forward is because the last thing we want to do is ever put people in the kind of position we all found ourselves in March, April, and May again.
Governor, you spoke of Juneteenth. There's a bill now that would make that a state holiday on June 19th instead of the Sunday closest to June 19th. Is that or any other measures to make Juneteenth maybe more visible in school education? Anything you would support if such a bill landed on your desk?
Well, I think you know that generally speaking, we don't talk about legislation that's pending because we don't know what it'll actually say when it gets to us. But I certainly said in my remarks that we would look forward to working with the legislature to come up with an approach to this that puts a much finer emphasis and a bigger point on Juneteenth.
The towns of Oxford and Yarmouth, like the tales of two communities. Oxford has spent money, time, and resources to put the gym out there. And on Tuesday, the Board of Selectmen in Yarmouth, they voted that they're not going to use any local resources to close any businesses and enforce restrictions. So what message do you have, and how do you propose to enforce the order if you have local select boards that are ignoring the order?
We spend a tremendous amount of time with our colleagues in local government, the Lieutenant Governor and Secretary Keneally and me, talking to them all the time about about the process we're following, the rationale behind the decisions we're making, what role we anticipate that they may have to play. A lot of the stuff that ends up in our industry-specific protocols comes from the conversations we have with local communities about what the rules of the game should look like and how they would actually play the role associated with supporting that. There have been instances ever since the beginning of this where some folks have gone farther than we've gone in some cases to put an even stronger or more strict set of standards in place than the ones we've proposed. Okay, there have been other instances in which people have taken a really hard approach to implementing and enforcing standards that we've developed, and some people have taken a lighter approach. A lot of people have used education, communication, and signage as the primary vehicle they've used to encourage people to comply. But the good news is, overall, the vast majority of the citizens of Massachusetts and the vast majority of the communities in the Commonwealth have stepped up and done the kinds of things that I believe have a lot to do with the fact that we have a 2.3% positive test rate right now and the lowest numbers we've seen in our hospitals and our ICUs in months. You'd have to talk to the U.S. Attorney's Office about that.
The protest started in this state more than 2 weeks ago now. And
Say again?
The protests started
Yep.
more than 2 weeks ago, and you're talking about the numbers continuing to decline. What do you think that says about the spread of the virus? Because clearly those were masses of people, some not all wearing masks together.
Well, the first thing I'd say is that there were a lot of communities whose public health departments went out and handed out masks to people as they gathered in places where these marches took place. And many people took those masks and put them on, which was great. Second thing is, were there 300? There were around 300 demonstrations and marches of one kind or another across the Commonwealth that had more than 100 people, okay? And some of them had thousands. The ones in Boston had thousands, but there were 1,000 people in Fitchburg. There were 4,000 people, I think, in Springfield, maybe more than once. But I would argue that in the vast majority of those cases, people did wear masks. They were moving and they were outside. And those are all really good things. But anytime a lot of people get together in any kind of large gathering like that, especially if they're not wearing masks, it's worrisome. And part of the reason we chose to put up more than 50 test sites for people who've been to large gatherings was because we wanted to know the answer. We wanted people to come in and take a test and see what it says. And I'm actually kind of excited about the fact that, according to Secretary Sutters, we had more than 16,000 people show up to take a test so far. 15,590. Okay, so we have today. We might. So, I mean, long story short, big gatherings, close quarters are a risk. Period. I mean, that's been demonstrated by almost everybody who's looked at the literature and studied this virus. Outdoors is way better with respect to managing the spread than indoors. That's also been proven by both experience and the literature. But the face covering stuff, which, you know, we've been like this with people on, has turned into a major tool in slowing and in many cases stopping the spread of COVID. And face coverings, when this all got started, really wasn't one of the primary recommendations coming from anybody. And I do think the fact that people were moving, you know, again, makes a difference.
Governor, when you announced your expanded testing program, you said you hope to be below 5% in December, as I recall.
And you didn't think we were going to get there. You asked a very skeptical question about that.
Well, I don't know if I did. You're at 2% now, very optimistic about the way things are going, and yet you're spending a lot of money to expand testing and a lot of money on contact tracers, lots and lots and lots of money. What is you're still believing that you can control it and we're not going to have a resurgence? So I guess I'm puzzled about what your rationale
Well, first of all, we've stood here many times and said that testing and tracing is an incredibly important part of identifying people who are sick, getting our arms around their close contacts, and then helping both of those groups isolate. And that's been what we've been doing for the past couple of months, and it's turned out to be a pretty effective way to connect with people and to help them stay isolated. And I think that's got to be part of the strategy going forward. Now, no one really knows what's going to happen in the fall, okay? In fact, we're going to talk to the Medical Advisory Board about that, aren't we? But there are plenty of people in the infectious disease world and the epidemiology community who say that pandemics like this have an echo, and the echo typically shows up in the fall. And we've talked to our colleagues in the healthcare community about how they and we should be thinking about this. And I absolutely believe that one way you reduce the size of the problem you have in the fall is by doing everything you can to squeeze as much of the heat out of the virus as you possibly can between now and then. And at the same time, as we've said before, as we move forward on reopening and as more people are in more contact with one another, in addition to people continuing to do the things they need to do around masks and distancing and everything else, we need to continue to enhance our capacity to test, especially with vulnerable populations and high contact communities, and make sure that testing is not an obstacle for people, and then use the tracing program to do everything we can to manage whatever the isolation issues that people have. I just think this is sort of part of a coordinated approach to maintaining the success that people have had over the past few months here, so that as we roll through the summer, we continue to carefully reopen, and we get to the fall, we're as well positioned as we possibly can be to work through what everybody says potentially is an echo.
So it's a safety, you're worried about the fall, so you want this excess, what would appear to be excess capacity to deal with something if it materializes?
I think the one thing I know about this is when this happened in February and March, there was scarcity on everything. There was scarcity on testing, there was scarcity on PPE, there was scarcity on data, there was scarcity on healthcare capacity, there was scarcity on infection control, protocols and capabilities, and we writ large, paid an enormous price as a state and as a country and as a globe for not being prepared. And we're not going to be caught by surprise in the fall.
Are you concerned with the infections that are ramping up in other states, that people may come here, vacate to the islands for a long vacation, can't quarantine? I mean, obviously, with more businesses open, there's more options to do that.
The answer to that is yes, and I think we'll probably have more to say about that next week. It's definitely something we've been thinking about.
Governor, office capacity went up to 50%. When might we expect the State House to open again? And what phase would the State House in?
Yeah.
It's not exactly clear in the plan.
Well, remember, the State House is not. The State House is actually under the jurisdiction of the legislature, and our orders, while they can choose to comply with them, they don't have to. And I think they and we talk about this issue a lot. But fundamentally, any decision to reopen this building, and it would have to be done with rules and guidance around all the kinds of issues we talk about when we talk about indoor gatherings, would have to be incorporated into that. But that fundamentally is an issue that we've had some conversations with the legislature about, but it's very important for people to understand that they got a lot to say with respect to how that happens and on what terms.
Is there any preferred timeline from you on reopening the building?
I don't want to speak for them on this. I don't want to speak for them on this.
Governor, phase 3, including the opening of gyms, could happen as soon as June 29th. I know we have to watch the data next week, but things do look good.
I'm just going to say point blank that indoor dining starts on Monday. We're going to want at least 2 weeks of indoor dining data.
2 weeks, so
I want
we
2
would not
weeks.
be
We
able to
want 2
start
weeks.
phase-
We want 2 weeks of indoor dining on data. Period.
Okay, so we're looking at phase 3 would be at the earliest a week from June 29th, so in July. Okay.
Question for Secretary Sutters. if you could.
Governor,
Yeah.
on the subject of, several communities across the state are concerned about fireworks, particularly illegal fireworks activity throughout the evening. I know that can be more of a local issue, but have any local leaders spoken to you about how much this is spread and how frequently it's happening, especially during the pandemic?
We've talked to a lot of our colleagues in local government about fireworks, and I can tell you this, there's been a fair amount of work done on the law enforcement side in New Hampshire and in Massachusetts that has rounded up some significant caches of fireworks. It's definitely a local issue, no question. Somebody wanted to ask Mary Lou a question?
Yes.
Was that?
One question. Almost everyone in the Commonwealth is collecting unemployment is getting a $600 federal bonus each week, which really exceeds the amount of their average weekly wage. So that ends on July 25th. Now, do you feel that should be extended? And when a government is giving employees more than what they work for in their average weekly wage, is that a form of dysfunction in government?
Well, I guess I'd say two things about that. The first is, I think appropriately, the federal government made the decision to create that additional payment because the vast majority of the people, like literally almost everybody who lost their job, first of all, they lost it immediately. There was no time to plan for that loss. And secondly, it wasn't because of anything they'd done wrong. Okay? I mean, every single person, for the most part, who lost their job because we collectively, state and municipal officials around the country made the decision to say, your business, for now, can no longer operate. So I have no problem with the fact that people felt they needed to create something that could serve as a cushion for all these people who didn't anticipate losing their job, didn't anticipate not being able to go to work, didn't anticipate any of that, and had it all taken away from them by the decisions we made to stop the spread. I know there are conversations in Washington about how to think about this issue on a go-forward basis, and ultimately that's their call. But again, I don't have a particular policy problem with the idea of being more generous over the short term associated with an unemployment benefit like this, when this was their unemployment, their inability to go to work, their loss of purpose was 100% a function of decisions that were made by people like me around the country who took their job away from them, basically. Do you want to?
Secretary Sutters, there have been infections at these emergency child care centers. Just wondering kind of how you're handling closing those or quarantine and how we will be in the months ahead.
Yeah. So as you know, we are in the process of moving from the emergency child care program into reopening child care. And we're in the beginning part of that. So there were 32 confirmed staff cases and 32 family situations. And of the 64 confirmed cases, involved 47 different programs, and overall it was 103 quarantines. And it was, and we had 550 emergency child care programs at the height of this, and 9 programs reported more than one single case. So we feel that actually that the reports to the local boards of health and the local boards of health helping a program determine whether the program needed to temporarily close or whether it was the identifying whether it was a staff or a family member and helping them isolate and quarantine has actually been fairly successful. And obviously these are lessons we have taken into reopening child care in Massachusetts, which we're in the process of reopening.
What do you say to parents who are prepaying for a lot of these just for months ahead and are concerned with having the quarantine, and what do they do with their child?
Well, as we know, the pandemic affects all sectors, and I would love to be able to stand here and say it didn't affect childcare either. And the reality is, given that we had 5,000 children in childcare in the Commonwealth of Massachusetts during the emergency and 550 programs, they were very small numbers and they were mostly isolated. And we're doing everything possible as we roll out childcare, which is, as I think you know, we rolled out the minimum health and safety standards a few weeks ago to help our childcare programs safely put in the physical distancing and other protocols they need to have in order to open safely in the Commonwealth of Massachusetts, because it's very important for parents in order to trust their child and trust their child to someone else, and for businesses to reopen.
Thank you, everybody. What's the